If you're experiencing chronic neck and back pain, weight-bearing x-rays will usually identify your problem. This chart shows a nicely aligned cervical and thoracic spine. It's nice and straight. The spinous processes are well centered. This x-ray, dated 4/11/2016, of a patient who was involved in a serious motor vehicle accident complaining of neck and back pain, you can see where the spinous processes of C6 and C7 are rotated to the right. The entire thoracic spine from T1 through T8 laterally deviates to the right, and the spinous processes are rotated to the right from T1 through 8. This patient was placed on a 3 times a week treatment regimen for 8 weeks, consisting of chiropractic care and physical therapy. After which, a follow-up film dated 6/8/2016 shows a cervical and thoracic spine much more aligned, nice and straight. The spinous processes are well centered. And this treatment resolved this patient's neck and back pain. This chart shows a lateral view of the neck with a perfect curvature from C1 through C7. This x-ray, dated 8/15/2016, of a patient who was involved in a head-on collision suffering from serious neck pain, you can see with the upper neck from C1 through C4 has totally lost all of its curvature, and from C5 through T1 there's a complete reverse curvature. Now this patient was placed on a treatment regimen of 3 times a week for 8 weeks of chiropractic care and physical therapy, after which a follow-up film dated 10/12/2016 shows a restoration of a perfect good curvature again, and the patient's neck pain was completely resolved. This lumbopelvic x-ray of a patient who suffered a recent fall on his right hip clearly demonstrates that the hip is now higher on the right than on the left. The sacrum is higher on the right than on the left. And because there's a pelvic tilt now down to the left side, the lumbar spine from L1 through L5 deviates to the left side considerably. We placed a 7mm heel lift under this person's left foot, retook the x-ray, and now you can see with the heel lift in place that the pelvis is much more level and the lumbar spine is much straighter. Now we'll continue to adjust this person, and as his spine corrects, we can reduce the size of the lift from a 7 to a 5 to a 3. If weight-bearing x-rays of your neck and back show a deviation from normal, then more than likely chiropractic care can resolve your neck and back problems.